Thank you so much for joining us for the 2020 Community Baby Shower for Mecosta and Osceola County. The goal of the baby shower is to ensure that all families have what they need in order to thrive. This baby shower is for all parents, mamas included, that have babies prenatal to the age of 12 months. During the Let's Talk series, we are going to be talking about 3 different things: resources that you may need while you're raising your child. The second one is supports you might need, and we all need supports, and also the opportunity to network with other families just like you. I hope you will join us for the Let's Talk series. We hope that you feel special, because you are. Let's talk.
Today we have Dr. Emily Bromley joining us to answer questions that were asked by you. Thank you for joining us, Dr. Bromley.
Thank you for having me.
Yeah, would you mind introducing yourself and giving us a little bit of information on maybe why you went into this profession?
Sure, I am new to the area. I'm originally from North Dakota and came to Grand Rapids for training. And I started the position here in Big Rapids in August, and I'm really happy to be here. I was hoping to get into a more rural community and help mamas in the rural areas. So I'm loving it so far.
Nice. We are glad to have you. And I believe I remember having meetings where we were counting down the days to having another OB in the area. So thank you for coming to the Mecosta Osceola area. We had when moms register for the community baby shower, what we had them do is just really list the questions or the concerns or some of the barriers that they're experiencing. And today I thought we could talk about 3 of those questions and see where we go from there. The first question we have, Dr. Bromley, and I remember I had this experience with my first child 32 years ago, and that's morning sickness. I mean, morning sickness for me did not even really stay to the morning area. And it really didn't go away after the first 3 months. So, you know, our moms are really listing this as a huge barrier as well. In fact, if I remember right, I think out of the almost 50 registrations we have, about 30 of them have listed morning sickness as a huge issue. Could you help us know more about morning sickness, and what would you share with those mamas if they were in your office today?
Absolutely, and it's really common that 30 out of 50 is pretty close to the average number of moms that'll experience morning sickness. Typically, it does stay within the first trimester, and at least that's what we hope happens, but it can take a little longer to resolve. And you're right, morning sickness is kind of just a term that we use, but it can be in the morning, it can be at night, it can be all day long. It can just be nausea, it can be nausea with vomiting. It's a little bit different for everybody. Unfortunately, it's a natural part of pregnancy, so it's not something that we can necessarily magically make go away, but we can certainly help prevent it and help treat moms who are experiencing it. The really important thing is to make sure that moms stay hydrated and drink plenty of water. And taking big gulps of water while you're having nausea isn't super helpful for the nausea. So it's really just small sips of water that we want you to take, and take small meals. That's one of the best things to do. So that's kind of a first line preventive measure, is just taking those small sips of water. The other thing to know is that in the first trimester, that the baby's not big. It's, about the size of my pinky nail and getting a little bit bigger than that, but it doesn't need a whole lot of food. So it's getting everything that it needs from the mom's body. So if you don't gain a bunch of weight, or if if you only gained up to 5 pounds in the first trimester, that's okay. The baby's getting plenty of nutrients. A couple of things that I recommend to prevent nausea or to help treat it would be some things that are non-pharmaceuticals or non-medical, including ginger. Ginger is a natural substance that really helps suppress the nausea. There's little things like ginger chews that has real ginger in it, and I really like them. Some people don't like ginger. Or there are like ginger ale that's really helpful. Also, there are like Prego Pops that you can get over the counter, and they're just little popsicles or like little suckers that kind of help to take those small sips and to suppress that nausea.
Oh, nice. Interesting.
Yeah, and the other one that is not necessarily a medication is that C-band that you can get from a pharmacy, and it's a
Mhm.
wristband or a bracelet almost that puts kind of pressure points on the wrist, and a lot of people really find some relief with those C-bands.
Mhm.
If we're going to go to pharmaceuticals, then something mom can get just over the counter is what's called vitamin B6. That is a vitamin that is known to help with the nausea and vomiting of pregnancy. It doesn't necessarily treat it. So if you're feeling nauseous or vomiting, taking a vitamin B6 doesn't necessarily make it go away. But taking it preventatively every 6 hours or so throughout the day can help diminish that nausea. If that doesn't help
Right.
alone, then doxylamine or Unisom is something that a mom can take at night as well. And it can kind of make you a little sleepy, kind of like Benadryl, but that with the vitamin B6 is really helpful.
Nice. Interesting. And I'm just learning so much right now because, again, my pregnancies were all quite a while ago. And interesting enough, none of those are that tells you that really we need to stay up to date and current because we're always learning new ways of doing things. And actually, I think sometimes better. Some people shared that they don't know when to call the doctor. Like this morning sickness is almost like, and not, I don't want to say flu, but they feel like they're really, really sick. But when it comes down to it, it is that morning sickness. When should mamas really call the office? Is there a general idea of when they should, if that morning sickness is really severe? Or what would you say to that?
Typically, moms do fairly well. Very few moms will have complications in pregnancy where what we call hyperemesis gravidarum, where they are actually losing weight because they're
Mhm.
not able to keep food down, or they're getting very dehydrated because they're not keeping any water down at all. If you're able to keep a little bit of water down, if you're able to keep a little bit of food down, you're probably doing okay.
Nice.
It doesn't make it feel better. And so
No.
if you need help with the symptoms, we also have medications that we can prescribe
Mhm.
that can be helpful for symptoms. And if one doesn't necessarily work, we have another that we can, we have a couple of options. So
Mhm.
sometimes moms think, oh, I tried it, didn't work, but come back and we can talk about it again and we can try something else.
Mhm.
So the one thing though that needs to be addressed is that if you are losing weight or you're extremely dehydrated, give us a call or go to the emergency room because you need to stay hydrated in pregnancy. And just as a human being, you need to stay hydrated.
Right.
So,
Right.
so those are the times when you need to seek help.
Very good. Sometimes when you're sick, you just don't feel good. And just knowing these are the benchmarks, I think would really help our mamas. Well, Dr. Bromley, I really want to talk about nutrition now. Now that we've talked about morning sickness and hoping that these mamas are able to keep some things down. Let's talk about nutrition. What would you recommend to the mom who is experiencing pregnancy, maybe not for the first time, maybe for the second, but how about those mamas that maybe had a baby or having a baby 10 years later, that it is almost like new because even though pregnancies really are consistent, new science or new data tells us different things. So when you talk about nutrition, what would you say to all of the scopes of mamas out there that could be expecting right now?
Well, I think good nutrition starts before pregnancy even, and
Yes.
it's really important to make sure that if you're planning on pregnancy, you really make sure that you have a well-rounded diet. You're getting plenty of food with vitamins and minerals, and you're really building up those stores in your own body so that when you do get pregnant, the baby has those stores to take those vitamins and minerals and all those good things from, and you're not losing too many.
Mhm.
Um, it's also really important, just even when you're not pregnant, to have a really well balanced diet.
Mhm.
Especially in pregnancy, though, we do really recommend having a diet of low fat, high protein, low carbohydrates, really kind of focusing on that healthy, almost the Mediterranean diet. And the reason for that is that weight gain in pregnancy can cause complications, and weight gain primarily comes from those high sugary meals, those high sugary drinks, and then persistently high fat foods that one might eat.
Mhm.
The complications can include high blood pressure, early delivery, a baby that's too large, increased risk of C-section. All of these things can come from excessive weight gain in pregnancy. And with that said, a normal weight gain, it depends on where you start with pregnancy, but kind of an average would be about 25 pounds.
Mhm. Mhm. So you bring up an interesting point when you talk about nutrition and it really starting before that you even attempt to get pregnant. And I really like that bit of information right there, because I really believe that really talking about nutrition all the time is important. And then especially if you're planning to get pregnant and have that baby. Let's talk about after that baby too. I know that a lot of times you see the mama six weeks later, in really talking about that nutrition, even post delivery. Would you again, whether that mama chooses to breastfeed or not, does that change anything when you talk about nutrition in that after the baby is born window?
It is really important to stay hydrated. Of course, during breastfeeding, you're producing almost a liter of fluid every day. And so you need to really make sure that you're replacing that. But in addition to that, making sure that you continue to take your prenatal vitamin even after having the baby. That's really important, because it's going to continue to replete your stores of calcium, vitamin D, iron, etc. And like I said, the baby will get those one way or another because it'll be produced, but your body might lose those. And so you really have to take care of your body in order to take care of the baby's body. So I think that that's important. And again, overall, having a really well-rounded diet, really cutting out those sugary drinks. Even juice is, a lot of people think, well, I'm drinking juice, that's healthy. Well, a lot of juices are made with sugar, and so they're not necessarily healthy. They can increase your risk of diabetes and also increase the baby's risks of obesity later in life.
Absolutely. I love that you're touching on that self-care piece, and that's a part of our community baby showers, really working back in self-care so that moms don't feel like they have to give 100% every day without recharging their own self. And so again, that starts with all the time in those pregnancy weeks and months as well, but even after that baby is born. So thank you for bringing that up as well.
It's kind of like that idea when you're on a plane, they always say, put the mask on yourself first, and then you can put it on the child, because you have to be there for the child. You have to be doing okay in order to help the baby grow.
Absolutely. One of the things that we offer here in the community right now is called Mom Power. And we've had a few groups now where moms have come through and really learned the importance of self-care and all of that. And it's amazing for me to see that so many moms are so excited about having these babies that they tend to forget about themselves. And so we're really looking at partnering with more entities and agencies and businesses to really bring that back in this community. So thank you. And I agree. Put your mask on first, right? You have to be there for your babies and everyone else, and really make sure that you're well cared for. Dr. Bromley, the last question that I want to kind of bring up with you and talk really about is all of these myths that really are passed down, not only from generation to generation, but also from within community members to other community members. I remember one of the things that my grandmother always told me is, oh, you need to gain as much weight as you can so that your baby will be healthy. And now I'm on the other side of the spectrum, so to say, where those heavy babies have really brought about some situations later in life in me, like you said. And so that was a myth that I believed because she was a trusted resource. My grandmother, I trusted what she said. And, she trumped the doctor. I'm going to be honest, is what my grandmother said, I believed. And obviously, it's really important to get your voice out there and that we share your voice. But, we've heard a lot of myths in this community. And it really, I guess my heart, and I'm really kind of sad about that because, again, I understand that people trust relationships in the community, sometimes over doctors, just like I shared. And one of the myths that I'm hearing, and I'm not sure if you've heard it yet, but I have heard the myth that marijuana curbs morning sickness. And a lot of what we're hearing is that mamas are utilizing that myth or using that myth and then finding out that it really didn't curb morning sickness. And now they're afraid to go to the doctor. And my heart goes out to them. Now, I can honestly say that I would, on it, if my grandmother said that and she was a trusted messenger, I'm really wondering, would I even believe that? And maybe not. But what do you want to see, or what would you want to share to those mamas out there that are hearing that trusted message from people? And how would you respond to that?
I think that is hard. I trust my mom too. I'm going to look to my mom for advice. So I don't think it's wrong to go to family for advice, but I think it's also important to gather a lot of information from reading, from your physician, from this organization, to really make a wise decision for yourself. And I'm really a supporter of patient autonomy. So if you come and see me and you're smoking marijuana, I'm not going to judge you. I want to take care of you. The problem with marijuana, it's becoming more acceptable just in the general community and nowadays, but we don't have a lot of research on it.
Right.
And the research that we do have on it isn't exactly awesome in terms of outcomes for babies. I kind of liken it to the 1950s when women were smoking and women were told, oh, you should smoke at least 4 cigarettes a day to really calm your nerves in pregnancy, to calm down. I mean, that was advised. And now we know, because it's been a while and because we have data from outcomes, that smoking can increase risks of stillbirth. It can increase risks of small babies who struggle to gain weight and who have other complications later on in life. So do we know a whole lot about marijuana in pregnancy? We know some. Some of the research that's been done has shown that there might be complications in terms of baby's brain development and neurological development. So function, not necessarily structure of the brain, but function of the brain. And so what that means is some studies have shown that the babies that have been born have difficulty with tasks such as motor skills and visual skills and things like that. There's also problems that they've seen with attention. And so while there's nobody's going to do a research study on moms, but in essence, if you are going down that path and you're trying marijuana in pregnancy and we don't have a lot of research, you're kind of doing your own study on your own child. You're kind of trying it out and seeing what happens, but there's no guarantees that it'll be good or bad. We just don't know.
We just don't know.
Yeah, we don't know. And so I don't recommend it, of course. And marijuana actually has a lot of the same compounds that tobacco, cigarettes have in them. And so we do know that those are not good. They cause cancer. And so I have to assume, we of course assume that those same compounds that are in tobacco and are in marijuana will likely lead to the same results.
Right.
In regard to the fear of coming to the doctor, like I said, I am here to help you. You know what I mean? I'm not here to judge anybody. I'm not here to send anybody to jail or anything like that. And in fact, yes, we test moms to see if they've used certain substances, but your ability to take your baby home if you've been using marijuana in pregnancy is not compromised. You can take your baby home. There's not going to be somebody coming and knocking at your door and investigating you. You know, we're probably going to chat about probably not a good idea to smoke marijuana in pregnancy.
Right.
But that's about it. I
Right.
think it's more important to come and get the prenatal care that you
Yes.
need and make sure the baby's healthy, and we can help you have a safe and happy delivery too.
Absolutely.
But there are no legal ramifications at this time with marijuana use.
And you bring up just something that really is on the hearts of us here in the Great Start Collaborative, but also other agencies and really families around the area of, really that prenatal care is so important and so critical. And don't let a decision like whether it's marijuana, whether you're eating and you think the scales are going to be a little bit too heavy, your doctor, to me, the doctors are always there to give you that good sound advice, even if you really don't want to hear it. And I remember hearing my doctor say, slow down on those meals or whatnot. And you just expect it when you see that scale. And I would think that the same thing is true no matter what we're doing to our bodies that might be not so good for the baby and even ourselves. And that's what I love about going to the doctors is you really get that care, regardless of whether, my grandmother might not tell me something I really need to hear, whereas the doctor will say it. So that's wonderful. And I also want to say that you talked about maybe those babies would be born with maybe some challenges with delays. So might have a harder time processing, or I would say some of those early on developmental milestones. And we know that early on services here in Mecosta and Osceola County can help parents and children go through those early on delays. So we, in this community, we are set up for anything that the mom or the baby might need before and after delivery. And I know that I would say that even Spectrum Health they are making referrals all the time for those babies who have been identified with some of those delays, regardless of the reason or the cause. Well, Dr. Bromley, I was wondering, do you have anything else you would like to share with the moms or anybody viewing this recording right now?
I think one thing is enjoy your pregnancy,
Yes.
and give yourself some patience and some grace and take care of yourself so that you can have a healthy pregnancy. I think a lot of moms try to control what happens in their pregnancy and what happens in their labor. And the fact is none of us can control it, but you can just kind of go with the flow and take care of yourself, and you can do what you can do. And we're here to support you. Like I said, we're not here to judge. We're not here to criticize. I'm here to hold your hand and take good care of you throughout the pregnancy and after pregnancy too.
Oh, very true. And I just want to thank you so much for your willingness to participate with this virtual community baby shower. And I look forward to more opportunities in the future.
Thank you so much.